All right, today we're going to dive into a really special kind of antibiotic. Think of it like a two-person special ops team that goes after those really stubborn bacteria. It's what doctors call in when the first line of defense just isn't cutting it. Let's see how it works. You know the feeling, right? Have you ever had one of those infections that just refuses to leave? That sore throat that comes roaring back, a sinus infection that hangs around for weeks, or maybe that nagging cough you just can't seem to shake? It's a super common frustration. And it's incredibly frustrating when that happens. It's often a sign that the bacteria have actually gotten smart and learned how to fight back against the usual treatments. When that happens, you got to bring in a more powerful, more advanced solution. So what exactly happens when those standard go-to antibiotics just stop working? This is a huge deal, and this failure of the first-line defense is exactly where our topic for today becomes absolutely critical. This is where doctors often turn to something called Cefuroxime Clavulanate. It's a combination medicine, and it's specifically designed to bust through the defenses that those resistant bacteria have built up. That's what makes it so effective for severe or recurring infections. So what's the secret sauce here? What makes this antibiotic so effective? Well, its power really comes down to a clever two-in-one approach. It's not just one drug, it's a team of two key ingredients working in perfect sync. Okay, let's use a simple analogy to make sense of this. Think of Cefuroxime as the battering ram. Its whole job is to smash through the bacteria's cell wall. But of course, clever bacteria have a defense shield, and that's where Clavulanate comes in. It's the shield breaker. Its job is to disable that defense so the battering ram can do its thing. So how does this whole battering ram and shield breaker strategy actually play out? Understanding this 1-2 punch is really the key to seeing why this combo is such a game changer against resistant bacteria. Here's that 1-2 punch in action. First, the bacteria puts up its shield. It's this special protein, an enzyme, that's designed to just chew up and destroy the antibiotic. But then, Clavulanate, our shield breaker, swoops in and neutralizes that enzyme. With its defenses totally down, the bacteria is left wide open for Cefuroxime, the battering ram, to smash through and finish the job. Pretty smart, right? So because this powerful dual-action mechanism works so well, Cefuroxime Clavulanate is incredibly versatile. It's used to treat a whole host of bacterial infections all throughout the body. I mean, the list of applications is pretty extensive. It's used for everything from respiratory infections like bronchitis and pneumonia, all the way to infections deep in the skin, bones, and joints. It's also a go-to for those stubborn UTIs and can even be used for more serious conditions like Lyme disease. Now, it goes without saying, a really powerful medication requires really careful handling. So let's cover some absolutely crucial rules for using this antibiotic safely and, of course, effectively. The single most important point, and I can't stress this enough, is this. This medication must only be taken under a doctor's supervision. They are the only one who can properly assess your specific situation. This is totally non-negotiable. Okay, so this table shows some general dosage examples for adults. You can see for something like a sinus infection, it might be 250 milligrams twice a day, while for a chest infection, that could jump to 500 milligrams. But please remember, these are just general guidelines. And I'm going to say it again because it is that important. Your personal dose will be decided by your doctor. It's based on the type and severity of your infection, your health history, and a bunch of other factors. Never, ever self-prescribe based on a chart you see online. There are also some really key safety precautions. For instance, if you have a known allergy to this class of antibiotics, you absolutely must not take it. And if you have certain stomach conditions or you're taking other specific medications like diuretics or antacids, you need to use it with extreme caution. And you guessed it, under close medical supervision. Look, like any medicine, side effects are possible. The most common ones are usually mild stomach issues, nausea or diarrhea. But you should know that rare but serious allergic reactions can happen. If you experience anything severe like swelling or you're having trouble breathing, stop taking the medicine right away and get medical help immediately. Okay, to wrap this all up, let's just distill everything we've talked about down to 3 simple non-negotiable golden rules for taking this or really any antibiotic. Rule number 1, finish the entire prescription, all of it. Even if you start feeling a whole lot better after a few days, the infection might not be completely gone. Stopping early is a recipe for a relapse, and it actually helps create even stronger, more resistant bacteria. And just to really hammer this point home, feeling better is not the same thing as being cured. Only completing the full course ensures you've wiped out all the harmful bacteria, not just the weakest ones. And And rule number 3 is the foundation for everything. Never self-medicate with antibiotics. A healthcare professional is the only person who can figure out if you truly need an antibiotic in the first place and which one is the right weapon for your specific infection.
You know, using powerful antibiotics correctly isn't just about our own health. It's about protecting their effectiveness for everyone, for the future. So the question we all really need to think about is this: how can our own responsible actions help protect these life-saving medicines for generations to come?